discussion, it cultivates an approach to teaching learners about topics where conversation can be ongoing among group leaders and members involved in discussion. When productive dialogue is introduced in a group setting, it lends opportunities for peer support and similar experiences to broaden perspective for group members. Advantages and limitations of group discussion is advantage of enhanced learning and cognitive domain. It's learner-centered and subject-centered. It stimulates learners to think about issues and problems. It encourages members to share their own experiences, provides opportunities for ideas and concerns. It's positive peer support and feelings of belonging, and it reinforces previous learning. Limitations of group discussion is one or more members dominate conversation. It's easy to digress from topic. Shy learners may refuse to become involved. Requires skills to tactfully redirect learners who digress. Challenging for novice speakers. More time consuming for transmission of information. And requires teachers present at all sessions. One-to-one instruction. So one-on-one instruction can be broken down to be tailored to meet objectives in all three domains of learning. And the stages of change as it pertains to one-on-one instruction, the pre-contemplation stage, the contemplation stage, the preparation stage, action stage, and maintenance stage. I'm going to elaborate more on this in a few moments. The three domains tailored to meet objectives include affective, cognitive, and psychomotor. So the cognitive domain is help professional educators might ask us, this is an example, cognitive domain, the help professional educator might ask a staff member to plan for how he or she responds to an angry family member. The affective domain, a family member emotional response to educator mediating a problem. And the psychomotor domain is how to implement strategies for family members' intervention. A pre-contemplation stage, elaborate more on the 5-stage models. Provide information in a non-threatening manner so that the learner becomes aware of the negative aspects or consequences of his or own behavior. Contemplation stage, support decision-making for change by identifying benefits, considering barriers to change, and making suggestions for dealing with these obstacles. Preparation stage, support a move to action by contracting with the learner and establishing small, realistic, and measurable goals. Providing information on effective ways to achieve the desired change, and giving positive reinforcement. The action stage, encourage constant practice of the new behavior to instill commitment to change by pointing out the benefits of each step achieved, providing rewards and incentives, and assisting the client to monitor his or her behavior through implementation of such strategies as keeping a food diary. And the maintenance stage is continuous encouragement and support to consolidate the new behavior and prevent relapses. So why is this important to know? A study identifying the homogeneous outcome groups in adult rehabilitation using cluster analysis. The effects of adult rehabilitation was broken down to subgroups depending on diagnosis criteria. The groups had statistically significant different patterns, medical complications, and functional self-care rates of progress, satisfaction of intervention, and courses of treatment. Each group had different therapeutic needs, and 2 groups needed physical assistance for discharge as it relates to functional care. How is group discussion relevant to OTs in a clinical setting? When discussions happen in a group with an OT leading conversation among group members, there is an increased probability that a multifaceted approach to a treatment intervention can be possible among group members. A study conducted with 5 groups researched about participants with similar outcomes and how rehabilitation can impact their prognosis depending on diagnoses. The clusters in the study were a representation of adherence for participants in the study. Study concluded that participants who entered rehabilitation at a later date tended to stay longer in the durations in terms of their intervention. So participants who started the intervention early tend to stop the intervention early, which made sense because if you started intervention previously compared to other participants, you'd go through the course of the treatment intervention faster than participants who started later during the intervention. So advantages advantages and disadvantages and limitations of one-on-one instruction. Education clients on a one-on-one basis is based on focus on individuals' needs to learn a subject area where group discussion may not be feasible. Domains of learning can be emphasized through one-on-one instructions as constant feedback and understanding of materials promoted through this learning structure. Advantages of one-to-one instruction is the pace and content of teaching can be tailored to meet individual needs. Ideal is intervention for initial assessment and ongoing evaluation of learner. Effective for teaching behaviors in all three domains of learning. Especially suitable for teaching those who are learning disabled, low, illiterate, or educationally disadvantaged. Provides opportunity for immediate feedback to be shared between teacher and learner. Limitations of one-on-one instruction: this learner is isolated from others who have similar needs or concerns. Deprives learners of opportunity to identify with others and share information, ideas, and feelings with those in similar circumstances. Can put learners on the spot because they are so focused on teacher's attention. Questions may be interpreted by learner as a technique to test their knowledge and skills. An educator may cram too much information each session, and learner makes mistakes.
All right, so a demonstration and return demonstration are instructional methods that are primarily used for psychomotor domain learning. Demonstration is when the educator is showing the learner how to do a specific skill, whereas return demonstration is when the learner tries to show their competence of the skill or task they were just taught with cues from the teacher if necessary. This is very similar to how we learned in our Human Movement Lab last term, where Dr. Gofredo and Dr. J demonstrate how to do MMT and how to measure range of motion. And then throughout the rest of the class time, we are performing a return demonstration to show what we have learned and asking for feedback, especially when it's our first time. Before doing a demonstration, an educator should inform students about the activity's purpose, the sequential steps involved, exact equipment that will be used, and the expected actions from them. Letting students know why each step needs to be done a specific way will also mitigate bad habits that could be formed. For example, during our lab with Dr. Gofredo, he demonstrates to us proper body mechanics and explains why our body should be positioned in a way during a step for manual muscle testing. This helps protect our bodies when working with clients, and it also prevents us from being in an incorrect position during a procedure. Using the exact equipment that a student needs to learn is also important here. An example of this is shown in the two different styles of wheelchair on this slide. If you are teaching your client how to use a reclining wheelchair in the hospital, you should not use a basic wheelchair to demonstrate it, because when they are discharged and goes home with the former kind, they might feel anxious and frustrated for not knowing how to use it. It's also beneficial to make sure that everyone has a clear view of what you will be doing and that they can hear you. For this reason, this type of method is best used in an individual or in smaller groups. Larger groups can still take part, but catering to their needs, such as putting up video screens for them to see, may be necessary. In addition, students in a demonstration are a passive learner because they're only observing the educator model the skill. However, it's still favorable for learning because it provides them a mental practice of the procedure prior to trying it for themselves. This type of method builds credibility around the teacher, who also serves as an inspiration for students to look up to. Should a mistake occur while providing a demonstration, the educator should use that moment to teach them on how to handle the situation and what they should do. It's also important to use scaffolding when teaching a task because this will help the learner break down a lengthy procedure and categorize them into small increments for better understanding. In a return demonstration, students are active learners, and the main role of the educator is to be a coach and not an evaluator, supervising students until they are able to be left alone to practice. When a student is performing the skill for the first time, it's important to provide lots of coaching and feedback and to emphasize that it's okay to make mistakes and not do it perfectly. On their next practice, you should be quiet and only provide cues and answer questions. You should also make efforts in avoiding too much conversation with the student to prevent interrupting their thought process. An increase in anxiety may be present here, so providing students some reassurance, praising, and letting them practice with the exact equipment will help increase their confidence and reinforce behavior. Scaffolding is also helpful so that mastery of the previous step is obtained before trying the next step. An example of a return demonstration is when we obtained our CPR license and we had to show our educators what we had just learned for competence. Since this targeted our psychomotor domain of learning, it was more appropriate to use a model rather than an actual human being in need of CPR to ensure safety. Overall, placing an emphasis on what to do rather than what not to do is influential in the student's success for this method. Now, the advantages and limitations of both demonstration and return demonstration are presented on this table. As you can see, one limitation that both methods have is their cost and effectiveness. One way this can be reduced is by reusing equipment and using videotapes for demonstration, which can be done in classes like an annual CPR review for healthcare professionals. For demonstration, the key advantage is that it allows for the exact behavior to be modeled by the educator. However, because the educator needs to be seen here, it's best suited for smaller groups and larger groups would need accommodations. For return demonstration, the key advantage is that it provides an immediate guidance to the learner, but it can be too much work for the educator to supervise and see each one's performance. Here's a case study to try. George is a 55-year-old male diagnosed with type 2 diabetes 10 years ago. His vision had declined and he recently learned how to use a special equipment to administer insulin. His supportive family is present with him for the session and states that George has not been compliant with adequately administering insulin to himself. Which of the following might be the best instructional method you would use for George to address medication?